Oh, we discussed a lot of numbers before the break, but here's a number to think about this morning. Half of Canada's population is 55 or older. That means we'll have a whole lot of people retiring soon. Our Sun papers will be examining the aging baby boom phenomenon over the next few days. Some columnist Simon Kent, one of the people working on the series, he writes, the soon-to-be retired know they are high in number, disproportionately low savings and destined to access a system already under strain. That's part of the series that zooms in on boomers, examining their issues from loneliness to long-term care. Simon joins me now right here in the studio. Now, Simon, we were just talking about this a little bit earlier. 55 and older, over half of our population. Like, you look at countries like Egypt or India, where it's maybe 20% or even less, and you have a huge population of youth. What's going to happen to us?
Well, that's a very good question, because in 10 or 15 years' time, all those people are going to be looking to retire, and they're going to be looking for healthcare, because your healthcare needs do get stronger and more broader as you get older. They're all going to be wanting to access the hospital system. They're all going to be wanting to look for care in all sorts of different ways. And so this series, in 4 parts, looks at the baby boomer cohort. When they retire, will they be able to go to hospital? Will they be staying at home and being cared for at home? Just what sort of future do they have? It's a demographic time bomb that's just ticking away very quietly.
So, you know, in other parts of the world, something that's quite common is a multi-generational family. So within one home, you'll have a kid, you know, the parents and the grandparents as well. Is this something that we might see in the future more and more of here?
The Western model seems to be much more fragmented now. People tend to live much more isolated lives, and the sorts of glue that used to hold society together. People would belong to their local church or their local social groups, that sort of thing. Families were much closer. That sort of nuclear family has dissipated. So more and more people are being left to live on their own. They're being isolated, they're being cut off, they're being shut in. So you're going to see a lot of baby boomers who won't be able to access the hospital system or the health system. They're going to be staying at home and to be visited maybe once or twice a week by a healthcare worker, and that's going to be their future. In a way, it's the shut-in boomers that we've got to start talking about now, because if we don't talk about this, if we don't formulate government policy, you're going to have a lot of people left outside of the loop.
No, it's frightening when we're saying that there's going to be a lot more people that are in a situation that they're getting older and older these days, but we have less of a support system than ever before.
And don't forget, we already have a health system that in some cases is under strain. In some provinces in Canada, it is really hard to adjust the health system, to make it pay, to make it reasonable. What are we going to do in 10 or 15 years' time when this great flood of people are looking for geriatric care, which is expensive, it's time consuming? How are we going to fit them into our health system when we have people who have their day-to-day needs? Do these older people just present at emergency and present looking for help with their ailments, or again, are they going to be sent home and said, no, you stay at home and we'll come to you and we'll look after you when we get to you? Which is a pretty frightening prospect. It sounds rather inhumane, but we have to talk about these issues now, because our health system all across Canada takes a huge amount of money, and it's a bottomless pit that goes into that. We have to make sure that that system is set up and it's able to cope for these ageing baby booms. It's a really complex discussion. That's why we took a 4-part series to tell it.
You know, a few years ago, I had the opportunity to go down to Florida and actually go to 2 different old age homes and visit the people there. Now, the whole thing there was, you know, these are people that pay a lot of money to go in, but they're extremely active. They go out on excursions, on trips, they horseback ride, they play golf every day. You know, fantastic. I mean, a fantastic setup, but that costs money. But in a sense, that's preventative care, because these people are very, very active. Is anybody putting that on the agenda, that maybe it's not about our hospitals or about the geriatric system, the care, but maybe preventative medicine, which in fact is just moving?
Well, that's a very good point, and the model you just pointed to, which really surprised me, because America's health system is so prodigiously expensive and really hard to access. And that's the very top level of care. That would be great. I just wonder how much of that is going to be available. But as you say, preventative medicine is the key, where you look after people as they enter those more senior years, 65 and over, 70 years and over. And sadly, some of the statistics we've pulled out is the predisposition for suicide amongst our older generation. They feel cut off, they feel isolated, and this is tragic. And again, this is a product of perhaps the way society is now. where the older people feel left out and they feel more shunned from the community. And this is a sad but essential part of this series as well. We talk to healthcare experts and we talk to people who are approaching this problem and trying to find solutions. It's a multifaceted thing. It's like a big moving piece of jigsaw puzzle, but it's essential we talk about these things as a society. Otherwise, people aren't disposable. You don't push people to the margins and forget about them. They're all part of our community, and it's up to all of us to talk about these things and make sure it's approached.
The interesting stat is what you just mentioned, that it's not youth, which we always think about when we think about suicide. It's men over the age of 65.
Correct.
They're the most susceptible group. And I can understand that, because as you age, you become sick, you lose your hearing, you lose your sight.
You lose your friends, you lose the support networks, all the things that sustain us when we're growing up. Our families sustain us on all those networks, and a lot of more senior people will say the thing they miss most about getting old is their friends. And that leads, again, to that sense of isolation. But as I said, people aren't disposable. You don't dispose of people because they hit a certain age and say, well, your time is over, you're pushed to the margins. They're all part of our community, and we're looking at ways at how we can approach this in 15 or 20 years' time when this demographic time bomb takes place, and how we address it right across Canada.
Here's another issue which I found very interesting, because it's kind of close to my heart: the dementia thing. In homes, or I should say in the facilities that we have, the long-term homes, 80% of people have dementia. Now, my father, when he passed away, he was in the sort of the later stages of dementia, which it gets very sad to see somebody going through that. But I remember visiting him and seeing dozens of people in the same vegetative state, and this costs money to keep these people alive.
Not only that, and this is presenting more and more because we're all living longer, and we're living longer than we ever have. I mean, longevity now is at its highest rate in human history. So more and more people are living to a more and more to greater age, and they're becoming they're going to be liable to taking these sorts of conditions on, and it's really hard to talk about. And where do these people go? Who's going to be caring for them? I get back to my original point. Our healthcare system across Canada is already creaking, and it's struggling to cope, and it takes huge amounts of money. And don't forget, when these people retire, they're no longer in the system working and paying taxes and contributing money to that general pool that has to fund the hospital and the healthcare. So that's another problem that we're going to have to face in the future. Who's going to pay for all this? Who's going to fund the care if you've got so many people who are retired and living on their savings, who aren't working and paying tax and contributing to the common pool? And they're going to be living on their savings, looking to the government for help. Let's hope the government has the finance to be able to do that.
And Simon, I guess at this point it's up to all of us to go to that neighbour, to go to that family member, the people that are in their advanced stages.
And knock on the door and go and talk to them.
Absolutely.
And ease that sense of isolation. And we can all do that, I guess.
Yes, we can.
Thank
you, Simon.
A pleasure.
That was Toronto Sun columnist Simon Kent. Be sure to catch Simon's series on Canada's baby boomers tomorrow through Tuesday in your Toronto Sun, and it's also going to be going national.